Well, hey everybody, this is Robert, and I'm going to go ahead and try to give a kind of a comprehensive update on what's going on with the COVID-19 situation across the globe. I'm going to focus on some of the countries that are sort of hotbeds right now and look at some other issues related to COVID-19. And we'll start out with this Johns Hopkins map, which is really fantastic. And what we see so far, we have 78,914 confirmed cases. Of course, about 77,000 are from mainland China, but numbers are starting to creep up outside of mainland China. As we can see, South Korea, Italy, and Japan all recording 100 or well above 100 in the case of South Korea. There's other countries that are really been on the radar in the past several days, like Iran. Lots of cases going on there and quite a few fatalities also. The total deaths over here is 2,467. And again, the vast majority in China. However, we are seeing more and more deaths in other countries around the world. And let's go ahead and start with South Korea. South Korea declares highest alert. They declared a red alert today as the infections are rising pretty rapidly. South Korea has raised its coronavirus alert to the highest level as the confirmed case numbers keep rising. President Moon Jae-in said that the country faced a, quote, grave turning point, and the next few days would be crucial in the battle to contain the outbreak. So far, 6 people have died in South Korea, and there's been 602 actual cases. And we can go on with South Korea, and it says, just 5 days ago, right, Tuesday, the number of confirmed cases in South Korea was 31. It's now 602. Many of the new patients were located in or near Daegu, South Korea's 4th largest city, where dozens of people linked with a Christian sect known as Shincheonji Church of Jesus have shown symptoms of respiratory illness. The church, which has about 150,000 adherents, says it has shared with authorities the names of members who may have been exposed to the virus and is encouraging them to enter quarantine. Then meanwhile, in this nearby city of Gumi, Samsung said it's shutting down a mobile device factory after confirming a case of coronavirus at the facility. And we're going to talk a little bit more about the economics of this later in the show. The Korean electronics giant said it is shuttering the factory for at least through the weekend. Quote, the company has placed colleagues who came into contact with the infected employee in self-quarantine and taken steps to have them tested for possible infection, according to a company statement. Another hot spot around the planet is Italy. And Italy's seen their numbers really skyrocket in recent days also. And it says here, authorities stopped Venice's famed Carnival events in an effort to contain Italy's spread of COVID-19. Italy stepped up measures Sunday to ban public gatherings amid rapidly rising numbers of COVID-19 cases in the country and a third death of the virus. And I believe that's higher than that now. And they called off the famed Venice Carnival, which is attended by thousands of people. The decision to call off Carnival was announced by Veneto Regional Governor Luca Zaia as the numbers of confirmed coronavirus cases soared to 152. Well, we also know that's risen also. There's 155, which is the largest number of cases outside of Asia. The ordinance is immediately operative and will go into effect at midnight, said Zaia, whose area includes Venice, where thousands packed St. Mark's Square. Carnival would have run through Tuesday. In addition, buses, trains, and other forms of public transportation, including boats in Venice, were being disinfected, he told reporters. Museums were also ordered to shut down after Sunday in Venice, a top tourist draw any time of the year. Authorities said 3 people in Venice have tested positive for COVID-19, all of them in their late 80s, and who were hospitalized in critical condition. Among this group is a nurse. So So the bulk of the cases in Italy, 110 of them, are in Lombardy region, and then the other ones are spread out through Veneto and some other parts of Italy. And there's been 2 cases in the south, and it's a Chinese couple in Rome found earlier this month. So Italy, South Korea, both are big news in recent days, and so is Iran. Iran now has 43 confirmed cases and 8 fatalities. The 8 fatalities is the most fatalities of any country outside of China to date. And their neighbors are shutting down the border. First, Turkey. Turkey has closed its border with Iran and halted incoming flights as a precaution to stop the potential spread of coronavirus. All highways and railways were closed as of 5 p.m. and flights from Iran suspended, Health Minister Fahrettin Koca told reporters. Flights from Turkey to Iran are still allowed. And again, like I said, 8 people have died in Iran, the highest toll outside of China. And Turkey's not the only one taking these types of measures. We also see that Iraq has extended a ban on Iran arrivals because of the coronavirus. And it says authorities in Iraq have extended a ban on all arrivals from neighboring Iran except Iraqi citizens as the country grapples with the possibility of an outbreak of the new coronavirus. Now, the statement did not specify how long the ban would last, which was first announced on Thursday. So, to date, there have been no cases in Iraq. So, we'll be keeping an eye on that. And the Middle East, there's more countries in the Middle East. Over in Israel, they've had a couple cases now. And it says a second Israeli who returned to Israel on Friday from the Diamond Princess, remember the cruise ship, in which there were 600 plus cases and some fatalities over in Japan. So there's been 2 returning Israelis from the cruise ship that tested positive. The medical center, the Sheba Medical Center, said that the individual did not contract the virus in Israel. This news comes as hundreds of Israelis have called a special hotline focused on treating people suspected of having contracted coronavirus, according to Magen David Adom. The health ministry has canceled upcoming trips to Poland for thousands of Israeli students, and only Israelis will run in Friday's Tel Aviv marathon. A mild panic has erupted across Israel on Sunday following the announcement on Saturday that 9 members of a large group of South Koreans who had been in the country from February 8 to 15 were diagnosed with coronavirus and might have had the virus while in Israel. The South Koreans traveled across the country from the north to the south with stops in Jerusalem and Bethlehem, among other places. So, going to be keeping an eye on Israel and the whole Middle East. There's a lot of coronavirus activity going on in that part of the world right now. Now, one part of the world that hasn't seen a lot of cases, knock on wood, has been Africa. Right now, there's only been 1 case, and that was in Egypt, imported case. But this paper from the INSERM press office entitled Egypt, Algeria, and the Republic of South Africa are the main gates for coronavirus importation in Africa. And it says those 3 countries are at most risk for coronavirus COVID-19 importation in the continent due to high air traffic with the contaminated Chinese provinces. But these countries are also among the best equipped on the continent to quickly detect and deal with new cases. In other African countries, the risk of importation is lower, but the health organization deficiencies raise concerns about rapid spread. So they did a little study taking a look at these possibilities. And it says the researchers evaluated the risk of virus importation according to the number of cases declared by each Chinese province and according to air traffic between the 3 main airports of each of these provinces, except for Hubei, which has had flights suspended, and each African country. Moreover, they analyzed the potential of each country to face the risk of the spread of a contagious disease using World Health Organization data and official data. Each country makes a mandatory annual declaration to the WHO of its resources to deal with an epidemic. It includes 24 items weighted into an overall score between 0 and 100, 100 being the strongest preparedness to face an epidemic. These indicators are legislation, adherence to WHO standards, laboratory skills, medical staff, emergency organization, food safety, level of equipment in healthcare centers, and public communication. The researchers also took into account the Infectious Disease Vulnerability Index, also noted out of 100, 0 corresponding to an extreme vulnerability and 100 to the lowest vulnerability. This takes into account factors not directly linked to the health system, but which can influence the response to an epidemic. For example, the size of the population, socioeconomic level, or even political instability or stability. Thus, the high IDVI and the SPAR scores are predictive to an efficient response in the case of importation. And I'll just read this last paragraph. The results show that Egypt, Algeria, and South Africa are the countries most at risk of importing the virus to Africa due to high trade exchanges with China. On the other hand, their SPAR and IDVI scores are among the best on the continent, letting effective detection and containment of the virus. Other countries like Nigeria, Ethiopia, Sudan, Angola, Tanzania, Ghana, and Kenya are at the lower risk of virus importation, but their scores are lower, raising fears of the non-detection of possible imported cases and of local or even national spread. And this is something that Dr. Tedros said during a briefing, WHO briefing, I think it was yesterday, that there is a big concern about this coming to Africa and the healthcare infrastructure there and how it could handle a rapidly spreading virus like COVID-19 or the SARS coronavirus 2. So, a very interesting paper. I encourage you to check that out. And then, to get off of the countries for a little bit, there was a study published recently in the Journal of Hospital Infection. And what they were looking at is, how long is it likely that these coronaviruses survive on inanimate objects? And how about what can be used to inactivate them? And I'll go over just two parts. I'll look at the summary and I'll look at the conclusion. And the summary says, let me open this up a little bit. Currently, the emergence of novel human coronavirus, SARS coronavirus 2, has become a global health concern, causing severe respiratory tract infections in humans. Human-to-human transmissions have been described with incubation times between 2 and 10 days, facilitating its spread via droplets, contaminated hands, or surfaces. We therefore reviewed the literature on all available information about the persistence of human and veterinary coronaviruses on inanimate surfaces, as well as inactivation strategies with biocidal agents used for chemical disinfection. The analysis of 22 studies reveals that human coronaviruses such as SARS, the Middle East Respiratory Syndrome coronavirus, or endemic human coronaviruses can persist on inanimate surfaces like metal, glass, or plastic for up to 9 days. But they can be efficiently inactivated by surface disinfection procedures with 62 to 71% ethanol, 0.5% hydrogen peroxide, or 0.1% bleach within 1 minute. Other types of biocidals were much less effective, including benzalkonium chloride and chlorhexidine digluconate. So they're saying this is really, really important since there's really no specific therapies available for treating people with infection with SARS coronavirus 2. And it's a really interesting study. I encourage you to check it out. But if I go down to conclusions, it says basically what I already said. Human coronaviruses can remain infectious on inanimate surfaces for up to 9 days. Surface disinfection with 0.1% bleach or 62 to 71% ethanol significantly reduces coronavirus infectivity on surfaces within 1 minute exposure time. We expect a similar effect against SARS coronavirus 2. Not known, but they expect it based on the research so far. Now, health officials are also very worried about the untraceable coronavirus cases outside of China. It says the World Health Organization officials are worried about further spread of the coronavirus as untraceable cases pop up outside mainland China, where the outbreak originated. The inability to identify the first patient in many outbreaks outside China has officials concerned that the virus may be spreading too quickly for standard public health measures to be effective. A number of spot fires occurring around the world is a sign that things are ticking along, and what we are going to have here is probably a pandemic, according to Ian McKay, who studies viruses at Australia's University of Queensland. For weeks now, China has quarantined the city of Wuhan, the epicenter of the outbreak, and more than a dozen other cities, affecting 60 million people. But the WHO said new clusters of the virus in Iran and South Korea could signal that it's becoming uncontainable. What we see is a very different phase of this outbreak depending on where you look. Dr. Sylvie Briand told Fox Business, "We see different patterns of transmission in different places." A global pandemic, as defined by WHO, is a disease that spreads on at least 2 continents. Well, there is some good work being done, though. It's moving along. I mean, is it coming at a fast enough pace? I'm not sure. But the University of Washington said that the clinical trials for their deadly Wuhan coronavirus will start in 3 months. The location of the trials have yet to be determined. So, 3 months. And as I reported on the website yesterday, outbreaknewstoday.com, that the University of Queensland are also working very closely on getting a vaccine moving along, and they've seen some success in getting it ready for pre-trials. So we'll take a look at that, see how that comes out. And then early trial results for potential coronavirus treatments expected in 3 weeks. It says preliminary results from 2 clinical trials testing potential treatments for COVID-19 coronavirus are expected in 3 weeks, WHO says. One trial combines HIV drugs lopinavir and ritonavir, while the other is testing U.S.-based biotech Gilead Sciences antiviral remdesivir. So we'll be keeping an eye on that. They note in the article that some scientists have claimed that anti-malarial drug chloroquine could be a potential treatment for the new virus, but currently there is no proof that that is effective. Local authorities in China have been using Gilead's remdesivir, which was tested as a possible treatment during the Ebola outbreak to fight infections. Some authorities are also using the antiviral drug Kaletra, a combination of lopinavir and ritonavir, on a compassionate basis. In the meantime, scientists are also working quickly to produce a vaccine candidate to be ready for human clinical trials. So we'll be keeping an eye on that. And let's take a look at something that's perhaps equally important, and that's the effect on the economy and the global supply chains. And we are starting to see some effects. Markets last week did take a hit a little bit, and don't know where this is going to go. But let's see what we can learn from these articles. This is from the Wall Street Journal. It said the last time a coronavirus outbreak hit China in 2003, right, the SARS outbreak, the global economy emerged relatively unscathed. Now, nearly 2 decades later, the growth dampening effects of a similar pathogen threaten to ripple around the world, transformed by China's boom. Chinese consumption and production power growth from Asia to North America, Europe, and beyond. Manufacturers worldwide are tethered to China by the tentacles of a supply chain that relies on the country's factories for many intermediate and finished goods. And that really leads me to the next article about different stocks that are being affected. Stocks like Apple, Nike, and others. The coronavirus continues to cause investor anxiety and market uncertainty. CNBC combed through recent Wall Street research to find where analysts are seeing buying opportunities amid the epidemic. And these include Apple and some of the others. You got to remember that Apple, for example, produces a lot of their product in China, and a lot of that's been shut down, basically. So that's going to affect the supply chain coming back to the United States and elsewhere around the world for new Apple products. So that's very interesting stuff and something to keep an eye on. Another thing is travel and tourism, right? Coronavirus challenges $45 billion cruise industry. Business is soft. People are scared to travel, according to the CEO of Norwegian Cruise Line. The coronavirus concerns have pushed the $45 billion cruise line industry to cancel trips and reroute ships as it struggles to contain the impact from fearful travelers. But the experts say that the industry will bounce back after the outbreak is contained. So Carnival, Norwegian, Royal Caribbean altogether recently announced they've canceled nearly 40 cruises and rerouted over 40. Shares are down across the three major cruise lines from 10 to 16% since January. And of course, the travel restrictions and so on and so forth are clearly affecting it. The news of Carnival's Diamond Princess and the more than 600 passengers on there and just kind of the chaotic conditions that happen there are clearly going to prevent people from wanting to even consider taking cruises, particularly in Asia at this time. France has seen a 30 to 40% fall in tourists since the outbreak has started. The drop-off in tourist numbers is an important impact on France's economy, according to the finance minister. France is one of the most visited countries in the world. Tourism accounts for 8% of its GDP. They say that France welcomes about 2.7 million Chinese tourists to the country each year, but that won't be the same this year. So they're expecting a big drop, and clearly, France is one of the biggest tourist destinations on the planet. But clearly other large European and some other countries are going to be facing very similar circumstances. So we'll be keeping an eye on that. That will continue on for a while. What's the U.S. government have to say? Well, according to the Treasury Secretary Steve Mnuchin, he said the economic impact of coronavirus will be clearer in 3 or 4 weeks. I can't read today. He was speaking with a reporter with CNBC at the G20 summit in Riyadh. Mnuchin said that it was difficult to make strong predictions about the economic impact of the outbreak right now. Quote, I think we're going to need another 3 to 4 weeks to see how the virus reacts until we have a really good statistical data. Although the rate of the virus spreads is quite significant, the mortality rate is quite small. It's something we're monitoring carefully. One of the discussions we're having here is that countries should be prepared, but I think we're at a point where it's too early to either say this is very concerning or it's not concerning. So, let me go ahead and close out with this. The White House is asking Congress for emergency coronavirus funding, but some people are saying it's not enough. And it says the White House will soon ask Congress for emergency funds to fight the coronavirus outbreak after weeks of hesitation by the administration to press for additional funding. However, the amount could be significantly lower than some public health officials have argued is necessary. potentially as little as $1 billion, according to 2 individuals, which could be rapidly exhausted by development of potential vaccines, widespread lab tests, and numerous other investments. So, again, a lot of the stuff I've spoke about in the past several 20 minutes or so could probably be irrelevant in 10 minutes. This thing is moving so rapidly, but this is the only way we can try to keep up on it on a regular basis. So we got some hot spots, right? We got South Korea, we have Italy, Iran, we have the effect on the economy, effects in tourism. Is there enough funds going into it all? I mean, I saw a report today that the World Health Organization says they're running out of money to fight the Ebola outbreak in DRC. So, I mean, things are getting very hairy right now. So we got to really keep a close eye on what's going on here. There is some progress on possible antivirals. There's some progress on some vaccines. However, this stuff's all going to take time. I mean, things are in the right direction, but it's going to take time. So at the website outbreaknewstoday.com, we'll be keeping a very close eye on this. And I'll try to put out more frequent updates on YouTube as I can. Again, the news just becomes old so rapidly, it becomes irrelevant. So I'll see what I can do. Anyway, I appreciate you listening. Share this with your friends. Like the video, comment below, and I'll see you next time on Outbreak News TV.